Today we're with Carl Joyner, CEO and President of TRIOSE Inc. Carl, thanks for taking time today.
Thank you.
Healthcare logistics, I'm interested in this. I don't know a lot about it. Tell me what is meant by healthcare logistics.
Wow. Well, healthcare logistics is a very broad field. It's interesting you're interested in it because not many people are. So that's one reason TRIOSE exists. Basically, healthcare logistics is simply put everything that moves in and out of a hospital. That's what we do. We manage that. Whether it's information flow, whether it's product, whether it's financial, that's what TRIOSE does. And we do it for hospitals all over the country.
Are there a lot of businesses that do what you do?
There is not actually. It's a very niche business. Healthcare has never really focused on business efficiencies until the last few years. Now they've gotten more focused, I guess, and then of course with the Affordable Care Act coming along, it's definitely put a huge focus on it. But we basically may have two major competitors nationwide. It's basically three of us that own this space.
Now, you started in '99. Did you start out in that healthcare niche?
Healthcare always. My background was logistics, global logistics, always with a healthcare emphasis. And in the mid-90s, we actually tried to, I was with a much larger corporation, we tried to bring business efficiencies in healthcare in a very large way, and healthcare wasn't ready. So in '99, I formed TRIOSE, and we thought we'd give little bits and bites to the healthcare industry, and did some consulting work, and instead of streamline a complete supply chain, we just give them little bits and pieces, and it's now taken off because the industry is now ready for massive change in logistics and supply chain, just as automotive was 30 years ago in electronics.
They have to be ready. They have to look for efficiencies to bring their costs down, don't they?
They have to. The money supply has run out. Outside of government changing their reimbursement schedules, insurance companies are changing their reimbursement schedules, and nobody ever really pays for fee for service anymore, so they have to play by a new model.
Now, when I see logistics, I usually think trucking, distribution, supply chain. I don't think necessarily of information logistics, but you said that's part of your business too.
That's actually the largest part of our business.
Talk about that.
We actually are an information data warehouse. Everything that moves, time, money, how soon, how often, mode optimization, best way to movement to get something from point A to point B from a supplier. That's what it's all about, being able to make good business decisions. In the day and age of the Walmarts, the way Walmart made their money, the way they brought their efficiencies in was through the supply chain. They know where everything's at what time, and what the impact of what they can sell something for or what their margin can be strictly from the supply chain.
Give an example of how the kind of service you might provide to a hospital that's not related to trucking things in and out, that's more on the business side.
Sure. Okay. For example, we anything that would go into a healthcare system. Let's say they have a construction project. We would be involved with the staging of that product from the manufacturer to the time it's actually implemented into the hospital system. So we would be involved on the front end. We'd be involved with the GC, the general contractor, understanding when these supplies or these pieces of equipment would be ready to come into an organization. And we would be the organization that would actually work with the manufacturer, with the GC, and actually with the riggers or the people that are putting the equipment into the hospital. That's just one component of what we do.
Right. Talk about how changes in the healthcare industry with the Affordable Care Act and consolidation, how have those changes affected your business?
It's actually very good for our business because what we're bringing to the whole healthcare industry is efficiencies. And in the past, healthcare systems have just always had the product there whenever they needed it and really didn't think about the best way to get it there. But as these organizations merge and consolidate, because there's not going to be 5,000 hospitals in the U.S. anymore, there's going to be probably 1,000 healthcare systems. And these systems have to operate and act like a business. And they're going to have to be able to put in, internal distribution models to get the product out more efficiently to their locations. And for example, primary care physicians. Physicians will now be the touch point for the community And they're going to be centralizing where those products come, and they're going to have to get them out to those point of care more effectively. So even though right now we do a lot of just transportation, we actually do have the expertise to carry them to that next level, and that's where we see TRIOSE will be in the next 10 to 15 years.
But transportation will still be a part of it. You see these for-profit organizations that now operate chains of hospitals nationally. You have a chain, a hospital in Pennsylvania, a hospital in Florida, a hospital in Texas. So now they've got to communicate across a large footprint, and that sounds like something that you would be able to.
We actually do that today. One of our clients is the Cleveland Clinic. We actually do it for them globally. So we're working with Dubai, over in the Middle East. We work in Canada. We work in Florida. We work in Arizona. Wherever they have a location, we're involved in bringing all that together and streamlining it.
So we talked a little bit earlier about how you still see things that you can accomplish with the company. What do you have, like a 5-year strategy, or what's the next kind of goal for your company?
We actually do. We've actually aligned strategically with a global logistics firm called UPS. You may have heard of them. So we do some work with them on a strategic nature. They're putting their footprint into healthcare much larger than they have in the past, and we're playing a part in that. As far as you'll probably see TRIOSE actually operating courier networks for large healthcare systems across the country, and then also these distribution centers for these ACOs, much like we were talking. We're actually designing one in North Carolina right now, and we're doing that in conjunction with a couple of other organizations, building the new supply chain for healthcare.
One last question. Why do all this from Berks County? Why are you here?
I worked for a man named Roger Pinsky one time, and he brought me up here, and we love the area. So my wife and I decided not to move. I'm a Texan that lives in Pennsylvania, and we love the area. So we've been here ever since. The people are great. The workforce is phenomenal. Everybody's got a great ethic up here, and we just love the area.
Carl, thanks very much.
Great. Glad I could help you out. Thanks for having us. And any other questions, please give me a call.